It's been almost a decade since a group of Danish researchers found a surprising connection between deep vein thrombosis and heart attack and stroke. In their analysis, they reported that patients who had a deep vein thrombosis or a pulmonary embolism were more likely to have a heart attack or stroke in the first year after such an event. A deep vein thrombosis, or DVT, is a blood clot that forms in a deep vein in the body. A pulmonary embolism is a sudden blockage in a lung artery, usually due to a blood clot that travels from a deep leg vein to the lungs. The Danish study suggested that when clots crop up in deep veins, they can follow later in arteries, causing heart attacks and strokes. The findings led to greater awareness on the part of the medical community about treating DVT, or PE, not only as its own condition, but rather to look further down the road at the possibility of related complications. We checked in with Dr. Charlie Hahn at Veins, Florida to find out more about deep vein thrombosis and how it's alleviated.
Deep vein thrombosis, the clots that are located within the deeper vein, usually they're in the pelvis. And those clots can travel to the lungs, which can cause pulmonary embolism. For varicose veins, they tend to be superficial. Those blood clots tend not to travel. They tend to develop blood clots because there's less blood flow. When you sit in for a long time, you kink off those veins in the pelvis, and then the muscle doesn't move as much, so it doesn't pump the blood back into your system. But they tend to develop blood clots, and they do not tend to develop varicose veins. I would suggest they can take some aspirin as prophylaxis if you're medically able, and also trying to get up and move around. As long as you move around, the leg muscle, they're pumping, and they will sort of like acting a muscle pump. They pump the blood and back and forth, and that will decrease the chance of blood clots. I would say about sitting like 3-4 hours, and then you get up and walk around at least about 20 minutes, 30 minutes. You know, traditionally, the patient come in with one set of problems or several sets of problems, and then you will usually either treat the patient or refer the patient somewhere else. For the vein patients, they tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. And I think nowadays the treatment is evolving, and more than some other traditional medical problems.
You'll find contact information for Veins, Florida under the DVT story icon on our homepage at yourhometownhealth.com.